Hi Anatomy, this is Miss Satterley. This video I'm going to include the scapula, the arm, and the leg, and also the hand and the foot. I'm going to start with the scapula. So scapula has 18 different structures on it that we're going to go over. I'm going to start with number one. Number one is called the acromion process. The acromion process is actually this structure in black right here, the acromion process. So it correlates with the shoulder. And we have the acromial region, or the tip of the shoulder. Number two is the coracoid process. That's on the other side right here, the coracoid process, and that's in green. Number three is the scapular notch. So you can see on the scapula right here, there's a little indentation out of it. That's the scapular notch. That's number three. So if I look at the scapula itself, it has several different borders on it, and they're named for angles, and they're going to be named after their directions. So 4, this is the top, so this is the superior border. 5 is the superior angle. 6 is supposed to be pointing at the lateral angle, which would be this. If you look at this, it's the structure right here, the lateral angle. This is the outside. Number 7 is pointing at this right here. This is a glenoid fossa. This is actually where the humerus fits in with the scapula to make your shoulder. Number 8 is right here at the neck of the scapula. Number 9 is Number 9 is the lateral border. Number 10 is pointing down here. That's the inferior angle. Number 10 is the inferior angle. And then 11, this is the subscapular fossa. Now, before I keep going, I'm going to talk about the other structures and then I'll point them out. This is called the spine of the scapula. Okay. And then there are 2 other fossas. They're named based on the spine. So this is superior to the spine, this is inferior to the spine. So this is the supraspinous fossa, and this is the infraspinous fossa. 13 is pointing at this structure right here. That's the acromial angle. I missed 12. 12 is actually the medial border, so the inside. Medial border, lateral border, inferior angle, and this is the superior border up here. 14 is actually referring to the glenohumeral joint. 15 is that supraspinous fossa. 16 is the infraspinous fossa. 17 is the spine of the scapula itself. And 18 is actually just referring to the body of the scapula. So this is the anatomy of the scapula. So now what I'm going to do is I'm going to go over the anatomy of the arm. So the bones in the arm, and then I'll go over the hand. This is the humerus. The humerus is the upper arm bone. I want to point out the stuff that I have colored on this because that's more of the important stuff. This is the head of the humerus. There's 2 tubercles is what they're called, the greater tubercle and lesser tubercle, and this is the intertubercular groove. Right here, this is a rough portion of a bone, which we call the deltoid tuberosity. Down here, I have several structures. This one kind of looks like a pulley when you look at it from the side. That's called the trochlea. The opposite side of that is the capitulum. And then we have some different structures in here. We have the lateral epicondyle and the medial epicondyle. This is the radial fossa that's in orange. And the green one is called the coronoid fossa. So this is on the front of the arm, so like the inside of your elbow is, or the antecuboidal region. Now if I go to the back, this is the olecranon region. So this is actually called the olecranon fossa. And that is where the ocrine process of the ulna is actually going to fit in. So those are the most important things on the humerus itself. So let's go over the picture. Number 1 is pointing at the greater tubercle. Number 2 is actually pointing at the head of the humerus. Number 3 is the anatomical neck. That's not one that I want you to know, but I do want you to include it in your bone book. Number 4 is the lesser tubercle. So the 2 notches or little processes on the top of the humerus. Now they're much easier to see on the bone itself, especially when I have them colored in. So the teal is the greater tubercle and the blue is the lesser tubercle. Number 5 is the intertubercular groove. Number 6 is pointing at that tuberosity. Tuberosities can either be named after the bone that they're found on or the muscle that attaches there. This one is based off of the muscle, which is called the deltoid tuberosity. Number 7 is the surgical neck. Number 8, I actually want you to put NA next to number 8. Number 9 is called the radial groove. And number 10, I want you to put NA next to. Let's look at the rest of the structure. So 11, that's the ocrine fossa. So that's on the back of the humerus. So the structure back here, the ocrine fossa. Number 12 is the inside. So the head of the humerus is the inside. So this is a medial epicondyle. And 17 is going to be the lateral epicondyle. Now let's look at all of these down here. So this is actually going to be backwards to what our bone itself looks like. They're a mirror image, but we can still go over it. So again, the head is the medial side, so 12 is the medial epicondyle. 13, which is green over here, 13 is the coronoid fossa. Next to that is we have the radial fossa, which is in that red color. 15 is actually pointing at the capitulum, which is this pink structure right here. And 17 is pointing at the trochlea, which is the black structure. Next, I'm going to talk about the anatomy of the radius and the ulna. So these are the bones in the lower arm. A is actually pointing at the ulna, and B is pointing at the radius. So again, the ulna, this is the ulna. This has the ocrine process on it that points out, and also it has a U shape right here. That's how I remember which one is which. And then B is the radius. This is the radius. It has a head on this end, and then the end of the radius. This is the one that's in your wrist, this side. Okay, so let's jump into the picture and I'll have the bones out when necessary. So number 1 is pointing at the radial notch. The radial notch is actually where the head of the radius is going to fit in. So it's right there. So it's the red portion, the radial notch. Coronoid process is number 2. The coronoid process is green right here. That actually fits into the coronoid fossa. Number 3 is on the radius. This is the head of the radius right here. Number 4 is pointing at the trochlear notch. The trochlear notch is where the trochlea actually fits into the ulna. And that is in the teal right here, the trochlear notch. Number 5 and number 13 are both pointing at the joints. They are named either proximal and distal and named after the bones that are involved in them. Number 5 is closer to the body, so that's proximal. Number 5 is the proximal radial ulnar joint. And 13 is going to be farther away from the body, so we call that the distal radial ulnar joint. Number 6 is the ocrine process. That is where it's basically your elbow. So if you feel your elbow or you see it, that's what you're seeing right there. That's the structure right here, the ocrine process. Number 7 is actually pointing at a tuberosity, and it's named after the bone this time. So it's the radius, so we call that the radial tuberosity. Number 8 is the ulnar tuberosity. Number 8 should actually be pointing to here. This is the ulnar tuberosity, which I don't have labeled. That should be pointing down, the ulnar tuberosity. Number 9 is the ulnar head. So this is the end. And then this right here is actually a styloid process. You have one of those on your skull. It's next to your mastoid process, which is the rounded projection. You also have a styloid process on your radius, and you have one on your ulna, so that's the next two. Number 10 is the styloid process of the radius, which is this pointy part right here. And 11 is the styloid process of the ulna, which is this pointy part right there. Number 12 is the ulnar notch. Number 12, that's actually where the radius is going to fit in. And that's that structure right here, the ulnar notch. 14, that space in between the two bones, we call that the interosseous membrane. When I show you the tibia and fibula, you'll actually get to see what that looks like because it's on the picture itself. Next, I'm going to talk about the anatomy of the hand. So I'm actually going to use the hand itself, and then I will look at the picture. So this entire thing is the thumb, and we call that the pollex. We have 3 phalanges. We have distal phalange, middle phalange, proximal phalange, and that makes up the fingers itself. The bones of the palm of the hand, these are metacarpals. And then we have the carpal bones down here. This one is called the pisiform. It's the one that sticks out right here. This yellow one right here is a triangular. Green is called the hamate. The blue right here is the lunate. The carpal bone that's right below the middle finger is the capitate. This larger one down here that has the spring with it, that's the scaphoid. And then we have 2 more. The outer teal one is called the trapezium. And then this inner kind of orangish one is called the trapezoid. So those are the 8 carpal bones. So let's actually do those on the picture itself. So again, number 1 is pointing at the distal phalange. Number 2 is the middle phalange. And then number 3 is the proximal phalange. Number 4 is pointing at the metacarpals. And now we have the carpals themselves. 5 is hamate. 6 is the pisiform. 7 is the triangular. 8 is called lunate. Number 9 and number 10 are actually pointing at the bones themselves. 9 represents the ulna, which lines up with the pinky, and 10 represents the radius, which lines up with the thumb. Number 11 is the capitate. 12 is pointing at the scaphoid. 13 is the trapezium. 14 is trapezoid. And then 15 is the whole entire thumb itself, which we call the pollex. So here's the femur. This is the head of the femur. You can see I have something colored in right here. This is called the fovea capitis. This is where a ligament that attaches the femur to the coxa itself is actually found right here. I have 2 structures that I have colored in here. One's teal and one is green. So these are actually kind of they correspond to the tubercles on the humerus, except they have a different name. We call them trochanters when they're on the femur. The dark green is the greater trochanter, and the teal down here is the lesser trochanter. This next thing right here, it's a rough surface, so I know that's a tuberosity. This one is named after the muscle that attaches there, and that's actually the gluteal tuberosity. Now down the shaft of the femur, we actually have what's called the linea aspera. So if I kind of rotate it, you can see there is a ridge on the femur itself. That's where a lot of the major muscle groups actually attach to the femur, linea aspera. Down here, this is the back of the knee. If we remember our body regions, we know that the back body region, or the back of the knee, is called the popliteal. So this is called the popliteal surface. If I flip it over to the front, the patella is actually located here, and that's the patellar region. So that is the patellar surface. So those are the main components of the femur itself that I want to go over. Now let's look at the picture itself. Number 1 is pointing at the head of the femur. Number 2 is pointing at the neck. 3 is pointing at the fovea capitis, which again is the red structure here, that fovea capitis. Number 4 is pointing at the greater trochanter, and then number 8 is the lesser trochanter. Number 6 is down here, that's the intercondylar fossa. These are actually condyles. We have condyles and epicondyles on the femur. So if I go back up here, this is going to be the medial side, which means 21 is the medial condyle and 18 is the lateral condyle. 20 is above, so this is we call these epicondyles. 20 is the medial epicondyle, and 17 would be the lateral epicondyle. Since we're down here, 16 is pointing at the intercondylar line. 15 is that surface on the back of the femur, which is called the popliteal surface. 14 and 13, you can put an A for both of those. 19, there's a little knob, which I usually have colored in, but I don't. It's, oh, I do. It's in purple right here. Right here, it should be colored in more, but that is the adductor tubercle. The adductor tubercle, there's a little knob right there. 22 is pointing at the surface on the front of the femur, which is the patellar surface. 12 is pointing at the linea aspera. 10 is pointing at the gluteal tuberosity. And 11 is the shaft of the femur. Number 5 is called the intertrochanteric crest, and that's because it's between the greater trochanter and the lesser trochanter. So this is the anatomy of the femur. Next, I want to talk about the tibia and the fibula. So remember big tib, little fib. So B is pointing at the tibia and A is the fibula. Number 8, you can see that is that interosseous membrane. So it shows up a little better on the bone book. I want to go over just a couple things on here. So this is the tibial tuberosity. So it's a tuberosity that's named after the bone itself. On the front, there's a line here, have it colored in. That's the anterior crest. The major thing that I want to point out is down at the bottom. I have a red and pink colored in. This actually makes up your visible ankle. So if you were going to touch the inner and outside of your ankle, you would be touching those parts of the bones. Those are both called malleolus. The tibia is on the inside, so that has the medial malleolus, and the fibula is on the outside, and that's called the lateral malleolus. And now let's look at the picture itself. So number 1, this is actually called the intercondylar eminence. Number 2, 2 and 5 are both condyles again. So your femur has condyles and so does your tibia. So the condyle is just a rounded projection. So number 2, that's on the outside, so it's a lateral condyle, and 5 is the inside, which is the medial condyle. 7 is pointing at that tibial tuberosity. Number 4 and number 10 are both joints, they're circled there. So we have a proximal and distal again. Number 4 is the proximal joint because it's closer to the main part of your body. So that is the proximal tibiofibular joint, and 10 is the distal tibiofibular joint. 6 is just an articular surface, and I have it labeled more than once, and that's because there are several different articular surfaces on the tibia itself. Number 3, I know I'm jumping around, but you guys can keep up with me. Number 3 is pointing at the head. You can just write head, and that's the head of the fibula. Number 9 is pointing at the anterior crest, and we should only have 2 more. We have number 11 and number 12. Again, those are both malleolus. Number 11 is the lateral malleolus because the fibula is on the outside, and then number 12 is the medial malleolus, which is on the tibia, which is the medial side of the inside of your leg. The last part of the bone book is the foot. I want to go over the foot itself, and then I'll go over the picture. Again, we have our phalanges here. Your distal phalange, middle phalange, and proximal phalange. Then we have our metatarsals. And then we have our tarsal bones, and there are 3 different names. We have our 3 sets of cuneiforms. This is called the navicular, and this yellow is representing the cuboid. And these have certain names. We have the medial, middle, and lateral cuneiforms. So medial lines up with the toe, which is the inside, middle is in between, lateral is on the outside. Then we have two more bones here. We have the ankle itself. The ankle region is the calcaneal region, so this is the calcaneus. And then we have the ankle itself, which is called the talus. Check out the picture here. Number 1 is actually pointing at the entire big toe itself, which is called the hallux. That was one of the body regions that we needed to learn. Number 2, 3, and 4 are all phalanges. 2 is the distal phalange, 3 is the middle phalange, and 4 is the proximal phalange. Number 5 is actually pointing at the metatarsals. 6, 7, and 8 are all of those cuneiform bones. 6 is on the inside or underneath the big toe, so that's a medial cuneiform. Number 7 is the middle cuneiform, and number 8 is the lateral cuneiform. 9 is the cube-shaped one, so that's the cuboid bone. 10 is navicular. 11 is pointing at the ankle itself, which we call the talus. And number 12 is pointing at the heel, which is the calcaneus. This is the last picture for the arm and leg. Hopefully you got through that. If you have any questions on this, please let me know. Have a wonderful day.